This life is hard, right? And not hard like I feel so sorry for you, just like acknowledgement, like it's hard. It's a different life than most of the folks that you live around have to live. You have to think of different accommodations for yourself. You have to have different considerations around your needs or your loved one's needs. And that can create an experience that does carry a lot of stress. And each stage of the journey has its own unique emotional needs, right? It's very, when you get that diagnosis, there's one piece of the puzzle. When you start to move into rare disease and you're trying to find the balance between what can, what can't, what's changed, what do I need to adapt, who did I see myself as being, who do I have the capability of being now, that can come with a lot of emotional activation. And then when I work with caregivers, maybe who have been caregiving for their partners or their children for a very long time, long-term management becomes the key cornerstone. What's going to happen with my child when I'm gone? What's going to happen to my partner if I get ill? What's going to happen if I get a diagnosis on top of this? So there's a lot of uncertainty in the rare disease journey. But the great news is you have the ability to make some changes in the way that all of that impacts you. Number one suggestion that I want to put in front of you today is the thing that you can change right now today is the way that you talk to yourself. Self-compassion, right? Self-compassion is so simple, and let me tell you why. Instead of what you would say to yourself, think about what you would say to someone else. So if let's say my friend comes to me and says, I'm going to write a book this year. I'm like, cool, all right, and how are you going to get that done? She's like, well, I'm going to get up every single morning. I'm going to write at least 100, I'm going to write 1,000 words. I'm going to write 1,000 words every morning before my kids get up. Okay, cool. I check back with her in 2 weeks. Hey, Karen, are you working on your book? Yeah, but, I've been getting up every morning. I've been writing the 1,000 words, but I just don't think it's very good. And, I don't know. It's just like I'm doing it, but it doesn't feel great. So, this is probably not what I'm supposed to be doing anyway. I should probably just shelve this. I could use the time in some other way. Would I say to her, you're right. It's a waste of time. Yeah, don't write if you're not going to write great stuff, You're right. You're being a little selfish as a mom. You could get up early and make a homemade breakfast for your kids instead of writing that book. Never. I'd be like, girl, keep going. You got that. You're still getting up. How do you know if it's good or not? You're just washing it through your own brain. You might be saying profound things that other people would find value in. What's important is that you've kept your commitment to yourself, that you were going to get up and do the work. Stay with it, girl. And guess what? If you don't do it one day, it's okay. You can get back on that horse again. But that's not how we talk to ourselves, right? We say the exact opposite. We say, why didn't I do more? Why did I snap? Why wasn't I more patient at the doctor's appointment? Why didn't I remember that the neurologist was at 2:30 and not 3:30? Why did I forget to check my chart before I came in the door? I forgot the cooler to keep the medications. We just constantly are in a cycle of why didn't I do more? And it's not just about the rare disease, right? It's like all the other things that you have going on in your life, your house, your home, your social life. Oh, I haven't called my mom in forever. Oh, I haven't seen my friend in forever. Oh, I'm horrible. These are the ways that we can change it. And the reason that it's good is because people who have more compassion for themselves have the capacity to be more compassionate to others. And this is where there's an intersection in caregiving, right? We're going to talk about how selfish we feel when we care for each other. But self-compassion, knowing what you need, being able to say back to yourselves, it's okay to take that moment. It's okay to walk away right now. It's okay to be on that overnight trip. It's okay to ask someone else to come in. All of that is going to lead you to being a better, healthier, more compassionate person for the people around you.